My name is Yusuf Aulia Rahman, and I am a medical doctor currently working as HIV clinic coordinator at Abdul General Hospital of Lampung Province in Indonesia.
My name is Otta Nur Kirana. I am public health specialist and currently working as HIV and STI program manager at Lampung Provincial Health Office in Indonesia.
Lampung is one of 30 provinces in Indonesia. It is located in southern tip of Sumatra Island, and it is populated by almost 9 million people, and it consists of a mixture of a group of people from ethnicity. But in general, Lampung is considered as low to middle income province compared with other provinces. Back in 2010, when HIV firstly started formally in Lampung province, we only had 2 HIV services throughout the province, serving around 7 million people at that time. So it was not sufficient. And in 2016, I was mandated as HIV coordinator at my hospital. And then in 2017, I had this very peculiar experience managing highly advanced HIV disease. The patient was a very young gay man. He came with unconscious due to neurotoxoplasmosis, but I managed to cure the infection. So dramatic that he returned from discharge from my care by walk by himself. It was very amazing experience. But he failed to return to my clinic for the life-saving antiretroviral. And eventually he returned 3 months after the first discharge in much worse condition. So at that time, I did not manage to save his life. And I thought that was preventable death. Upon further digging with his father, he told me that they were only small traditional fishermen with only daily income around $2. And they require around $200 to reach our clinic, which was 130 kilometers away from their home. So I thought that his death was unacceptable, and what truly has killed this young man was inequity. Inequity has killed this man. At that time, the case really opened my eye. I have to do something to take down the barriers and brought the HIV diagnostic and therapeutics much closer to people immediately. At that time, I reached Otta. I asked her how actually she wanted this program to be. She told me that we need at least one HIV service for each municipality. So we need to add more HIV services throughout the province. Then I met my hospital director at that time and told him that we need to gather new HIV team for our hospital and then get trained by the Ministry of Health for HIV care, support, and treatment skills with help with Otta from Provincial Health Office. And after that, we went back to our hospital and then we start the HIV treatment, fulfilling the clinical needs. And then eventually, we were very lucky that the Ministry of Health also had the program to expand access to antiretroviral throughout the nation. So they provide all the resources needed to add all the HIV, establishing new HIV services, and they provide training as well. At that time, around 2018, our HIV team from the hospital transformed into HIV trainers. We were trained to become trainers. And then we start training other HIV members from other HIV care facilities, and then train them about HIV care support and treatment skills, and help them to establish their own HIV services much closer to people in rural areas. So now we absolutely managed to successfully add almost 250 new HIV services. As mandated by Indonesian Ministry of Health, every new HIV care services should be consist of 5 different professionals. They were doctor, nurse, laboratory technician, a pharmacist, and reporting officer. When we have these 250 new HIV cases, so I have trained around more than 1,000 people throughout these 5 years.
Mengetahui adanya kesalahpahaman ada di berbagai tingkatan pemerintah, tenaga kesehatan, bahkan media sosial ketika terjadi peningkatan kasus, terutama penemuan ODIF baru seiring dengan penambahan layanan HIV yang telah kita latih. Untuk membalikkan pemikiran tersebut, cara yang paling mudah adalah dengan membandingkan bahwa angka penemuan yang ODIF yang saat ini telah ditemukan itu ternyata masih jauh lebih rendah daripada estimasi yang ODIF yang ada di area tersebut atau suatu daerah tersebut. Sehingga kemudian yang menjadi kekhawatiran adalah bagaimana menemukan ODIF yang memang belum ditemukan tersebut, karena mereka masih menjadi sumber penularan bagi masyarakat di daerah tersebut. Salah satu cara yang paling efektif kami pikir adalah dengan penambahan layanan tes dan pengobatan HIV pada setiap daerah yang ada di Provinsi Lampung. Selain juga memerangi stigma dan diskriminasi terhadap ODIF. Cara untuk menurunkan stigma dan diskriminasi terutama pada tenaga kesehatan adalah dengan meningkatkan pengetahuan mereka melalui pelatihan, webinar, dan pada setiap kesempatan yang bisa kita berikan untuk peningkatan kapasitas terhadap tenaga kesehatan. Selain itu juga kami juga mengadakan penurunan pelatihan maupun pertemuan untuk penurunan stigma dan diskriminasi khususnya pada tenaga kesehatan, di mana mereka di situ sharing secara erat kepada teman-teman ODIF maupun teman-teman populasi kunci itu cukup berhasil dalam penurunan stigma diskriminasi bukan saja pada tenaga kesehatan tapi juga kepada pimpinan fasilitas kesehatan dan juga pada dinas kesehatan yang sempat kami latih.
Since 2017, and have done so many efforts to decrease the barrier towards the ARV access. So now we currently observing the increased number of remaining operational HIV care services throughout the province, and also the increasing number of case finding without overburdening the hospital. So we managed to distribute the patient almost equally to every HIV care services throughout the province in order to reduce the burnout among the workers. We are also observing the decreased trend in loss to follow-up cases. It reflects very much that people nowadays accessing antiretroviral much easier compared with the earlier years of our work. As a medical doctor working in this HIV field, I felt very happy observing this improvement of HIV care quality. And also at the personal level, I felt very much happy witnessing patient transformation from the beginning they're sick and now they got back to their productive state. It really brought me happiness as a medical doctor that really staying to be with them across the journey of their seeking the back to their healthy. Yeah. Since 2017, the challenges also have been changed. Now we're currently having 270 HIV services remain operational throughout the province, but maintain them to remain operational within the next few years, few decades. That's the challenge. So I currently observe the unmet needs of HIV training centers that are accessible for health workers. So now I'm working to transform our hospital into learning ground that accessible for any health workers that interested in HIV care support and treatment skill. In 2017, back then, we were among three lowest achievers compared with other provinces. But now we are observing the trend that we managed to set our province among the best provinces in achieving national HIV program targets set by the Ministry of Health.
Sebagai seorang pengelola program, perbaikan itu nyata ada di Provinsi Lampung. Ada layanan yang meningkat kualitasnya, audit yang meningkat kualitas hidupnya, dan juga penularan pada audit dan penularan kepada masyarakat dan juga anak-anak yang sebenarnya bisa dicegah itu dapat tercapai.